In order to truly reestablish an adequate base from which our patients can optimally recover their functional strength requirements, we must include in our post-surgical protocol a level of neuromuscular reeducation that is capable, as shown, of restoring a balance between the partially or potentially fully inhibited motor units within the rotator cuff and the historically hyperactive muscles. For example, if it is recognized within the early stages of reaching a deficient contribution from the involved portions of the rotator cuff in initiating a force-coupled balance to that of the deltoids actions, while simultaneously receiving an excess influence from the upper trapezius or the levator scapula, then the task at hand is to facilitate as well as reintegrate back into the equation the normal input of the weakened muscles. Note within the capacity to balance or calm the hypertonic state to both restore unprotected and relaxed breathing within the recovery of the respiratory diaphragm, while simultaneously simulating a functional meaningful reach through the full kinetic chain.